So the theme for this question is critical care. You have the different types of shock here. For each of the scenarios outlined in the tables below, please select the most likely diagnosis from the list. Each option may be used once, more than once, or not at all. A 45-year-old man is admitted to the intensive care unit following a laparotomy. He has a central line, pulmonary artery, catheter, and arterial lines inserted. The following results are obtained: pulmonary artery occlusion pressure, cardiac output, systemic vascular resistance. Okay, this guy is following laparotomy. There's a central line, pulmonary artery, catheter, and arterial lines inserted. Following laparotomy, maybe he's bleeding. Let's look at the objective results and try and interpret what shock he's having here. So pulmonary artery occlusion pressure. Where is this pressure? Cardiac output is low. Cardiac output is low, so it's unlikely to be hypovolemic, right? Wait, hypovolemic, because there's low volume, cardiac output will be low as well. Systemic vascular resistance is high, which means it's not a septic shock. It's probably compensating, maybe for the hypovolemia. Pulmonary artery occlusion pressure measures pressure in the lungs. Arteries in the lungs, I guess. Let's think about it one by one. Hypovolemia fits the picture, I think. Normal, definitely not normal. Cardiogenic shock. Cardiogenic shock, your cardiac output is low, yes. Systemic vascular resistance is high, yes. However, your pulmonary artery occlusion pressure should be high because your heart is not pumping properly. It should backflow to your lungs, and then your pulmonary artery occlusion pressure should be high. Yeah, let's just try and find out where exactly pulmonary artery occlusion pressure is measured so we can interpret these things better, or maybe after we've answered everything. Yeah, after we answer everything. Otherwise, okay, septic shock is definitely not the answer because systemic vascular resistance in septic shock is low because of the vasodilation. So I'm going to answer hypovolemia for this one. A 75-year-old man is admitted to the intensive care unit following a laparotomy. He has a central line, pulmonary artery catheter, and arterial lines inserted. The following results are obtained. So, in this case, pulmonary artery occlusion pressure is high, cardiac output is low, and systemic vascular resistance is high. So, in this case, I'm thinking more of a cardiogenic shock. So, because the heart can't pump blood out, congest the lungs, so pulmonary artery occlusion pressure is high. Cardiac output is low because the heart is not pumping properly. Systemic vascular resistance is high as a compensation for the cardiogenic shock. A 22-year-old lady is admitted to the intensive care unit following laparotomy. All of them follow laparotomy. She has central line, pulmonary artery catheter, and arterial lines inserted. Following results are obtained. So in this case, pulmonary artery occlusion pressure is low. Cardiac output is high though, and systemic vascular resistance is low. In this case, probably vasodilation causing the systemic vascular resistance to be low, and then the heart is compensating by increasing its heart rate, increasing cardiac output. Pulmonary artery occlusion pressure low, probably a normal low. In this case, I'll answer septic shock because of the vascular resistance by cardiac output. Let's see. So first answer is correct, hypovolemia. Second answer is correct, cardiogenic, and third answer is correct, septic shock. Cardiac output is lowered in hypovolemia due to decreased preload. Yes. In cardiogenic shock, pulmonary pressures are often high. This is the basis for the use of vasodilators in the treatment of pulmonary edema. Decreased systemic vascular resistance is a major feature of sepsis. A hyperdynamic circulation are often present. This is the reason for the use of vasoconstrictors. Okay. We just wanted to go and find out about where they measure this thing, right? There are notes here. So let's have a read. The pulmonary artery occlusion pressure is an indirect measure of the left atrial pressure. Left atrial pressure. Okay. And thus filling pressure of the left heart. Okay. Low resistance within the pulmonary venous system allows this useful measurement to be made. The most accurate trace is made by inflating the balloon at the catheter tip and floating it so that it occludes the vessel. Which vessel are you occluding? If it's not possible to occlude the vessel in this way, then the measurement gained will be the pulmonary artery and diastolic pressure. And diastolic pressure. What are you occluding? What vessel? Let's have a look. What's the term called? Pulmonary artery occlusion pressure. So probably occluding the pulmonary artery. Pulmonary wedge pressure or cross-sectional pressure, also called pulmonary arterial wedge pressure, pulmonary capillary wedge pressure, or pulmonary artery occlusion pressure. So many names for one thing. Okay. Let's see any diagrams of the device being inserted. So you can't really see, it's too small. How about this? This one. Okay, it goes into superior vena cava, it goes into the right ventricle, into the pulmonary artery, and you occlude the pulmonary artery. And then you measure the pressure here. Distal point in branch of pulmonary artery, balloon inflated. So you occlude the pulmonary artery and you measure the blood pressure after that, which tells you filling pressure of the left heart. Okay. So interpretation of pulmonary artery occlusion pressure, normal will be 8 to 12 mmHg mercury, low is less than 5. Low if pulmonary edema is, low is less than 5, found in hypovolemia. Low if pulmonary edema less than 5, found in acute respiratory distress syndrome. What happens in ARDS? There's inflammation in the lungs, right? Probably it's low because the alveolar capillaries are leaky. As you leak blood out, you decrease pressure in that area. And after you wedge the pulmonary artery, yeah. If it's high, the scenario is overload, usually finding more than 18. Okay, when combined with measurements of systemic vascular resistance and cardiac output, it is possible to accurately classify patients. Systemic vascular resistance is derived from aortic pressure, right atrial pressure, and cardiac output. Okay, systemic vascular resistance AT equals 2 times the mean aortic pressure minus mean right atrial pressure divided by cardiac output. Okay.